Cardiomyopathy by KarenCovarrubias. Cardiomyopathy is a term that refers to a group of diseases affecting the heart muscle known as the myocardium. In these conditions, the heart muscle becomes weakened, enlarged, or stiff, which can impact the heart's ability to pump blood effectively. This dysfunction can lead to various complications, including heart failure, irregular heartbeats, and in several cases, sudden cardiac arrest. There are several types of cardiomyopathy, and they are classified based on the specific changes in the heart muscle and the causes of the changes. The main three types are dilated cardiomyopathy, and basically the heart chambers become enlarged. And then there's hypertrophic cardiomyopathy, and the heart muscle gets thick. And then there's restrictive cardiomyopathy, and this is basically the heart gets thick and it becomes thick. Cardiomyopathy can be caused by genetic or environmental hazards or behavioral factors. For example, if you have somebody in the family who has had it before, most likely they can pass it down to their following generations due to genetic mutation. If you have a genetic syndrome, like metabolic disorders, that can include cardiomyopathy as one of their symptoms. Environmental factors include being exposed to certain toxins and drugs, and also behavioral risk factors include alcohol abuse and uncontrolled high blood pressure, obesity, and poor diet. There's a lot of AI models out there that help assist the risks of anybody developing cardiomyopathy, but the main ones are cardiovascular risk prediction, and those basically take patient data and medical history, and they predict the risk of somebody having cardiomyopathy. And then there is genomic risk predictor, and basically it analyzes the genetic data to estimate an individual's genetic risk of having it. And then there is echocardiogram analysis, and basically that takes images and it identifies any patterns that lead to cardiomyopathy. Cardiomyopathy can affect individuals of all ages, race, and gender. However, certain demographic factors and risk factors can influence its occurrence. For example, in age, dilated cardiomyopathy is often diagnosed in adults, whereas hypertrophic cardiomyopathy can be diagnosed in children and adults, but also mainly in men. And also family history. If you have somebody who has had it, a close family member, you run a higher risk of also having it. And then cardiomyopathy is also a symptom of a genetic syndrome. Cardiomyopathy can vary based on the specific type and the geographical location in the population study, but for example, in the United States, the American Heart Association estimates that approximately 1 in 500 individuals in the United States has hypertrophic cardiomyopathy because it is the most common type. And in children, about 1 in 100,000 can have dilated cardiomyopathy. And then in other areas, global areas, the rate of cardiomyopathy differs based on region and ethnical factors, and some populations also have a higher prevalence rate of a specific genetic mutation linked to cardiomyopathy. The heart is the main organ that is affected with anybody that's diagnosed. The heart valves, the blood vessels, and the heart muscle are the main parts of the heart that become affected. The heart muscle, known as the myocardium, changes in its structure, and its function becomes affected because of the enlarged heart chambers and the thickening of the muscle. Be, when it gets thick, it becomes stiff, and it makes it difficult for the valves and the blood vessels to pump blood how it should effectively. The normal contraction and relaxation of the heart muscle are compromised, impacting its ability to pump blood effectively. Reduced cardiac output leads to inadequate oxygen delivery to organs and tissue, causing lots of symptoms like fatigue and weakness, shortness of breath, swelling. You can get the swelling in the legs or your ankles, and then irregular heartbeat, and also chest pain. Here is a diagram of the different stages of cardiomyopathy. So in the middle corner, we have what a normal heart is, and then the three other hearts are the different kinds of cardiomyopathy. So to the right top corner, we have the dilated. To the left bottom, we have the hypertrophic, and to the right bottom, we have the restrictive. So if we look at the right top corner, that is the dilated, and it is the when the heart chambers become enlarged, making the muscle smaller in size. And then if we go to the left side, that is the hypertrophic cardiomyopathy, and it basically the muscles become very thick. And then in the restrictive, and so that is on the right bottom corner, we have the muscles they are still thick, so it's basically hypertrophic, but the muscle becomes very very stiff, so it makes it hard for the heart to pump blood how it should. If left untreated, cardiomyopathy can lead to severe complications, and that includes heart failure, irregular heartbeats, which can increase the production of blood clots, and organ damages. Insufficient blood to vital organs can cause damage to the liver, kidneys, and then reduce quality of life. Unfortunately, chronic symptoms such as fatigue, shortness of breath, and can significantly impact a person's life, and it can eventually lead them to having a stroke or a cardiac arrest. Diagnosing involves a combination of medical history assessment, for example, physical examinations, and various diagnostic tests like medical history and image studies. So for image studies, there is the echocardiography, and it's the ultrasound that creates an image of the heart, providing information of the shape and function. MRI also helps detail images of the heart, and then the ECG or the EKG record the electrical activities, helping identify any irregularities, any abnormalities of the heart. And there's also blood tests that can be done to see if there's any indication of heart damage or specific underlying causes. AI models aid in risk detection, image analysis, and personalized treatment strategies. So to treat cardiomyopathy, there's several things you can do. There's medication. You can do beta blockers to improve the heart function, or diuretics to reduce the fluid buildup. There is also device therapy, so implantable cardioverter. I don't know how to say it, but it's the ICD, and it's basically the monitors the heart rhythm and delivers shocks, so like the pacemaker. And then there is the CRT, which is the coordination contractions in the heart chambers for improved function. There's also surgery. There is heart valve repair. And heart transplant. There's also lifestyle and behavioral modifications that can help reduce the risk or help you feel better. So like dietary changes to like low sodium, exercise programs. Exercise is always good. And then reduce smoking, drug use, and alcohol use. Also, I would say probably like energy drinks. And medications may cause side effect, and surgeries are risky. And also the prognosis varies based on the type of cardiomyopathy and how a person can respond to treatment. Here's a list of my references. And that's it. Thank you for watching my presentation.